Hello, hello. So I'm Isabelle Amigues, MD from Unabridged MD. And first of all, I want to thank you for the comments. I want to thank you for the comments on the YouTube channel as well as by email and so on, and in person. It makes me very happy to know that I can provide some hope in my patients as well as other people. It's a true honor and a true pleasure to do this for you. And one of the questions I had recently really touched me, and I thought that I would discuss a little bit about it. So the question was as follow: How there were two questions. One was, how did you manage to be a patient while still being a physician, and was it hard? And the second question was, how do I know if this treatment is right for you? Is right for me, sorry. So this is extremely, extremely important. So the first question is, how did I manage to be a patient? So if you have listened to the fear episode and where I describe how I really decided that I was going to become a mom, no matter like how scared I was about having very preemie, you also understood that, like, I also learned that I decided very clearly that I was going to just be a mom and not a physician, because I was not specialized in this particular specialty, so neonatologist. And for me, when I had my cancer, I decided to do the same. So I decided to not look at any studies, and I asked someone else to look at the studies for me. And I was like, yeah, just share with me what's positive and a good outcome. I don't want any numbers. Just tell me that things are working and that I have hope and that there are many plans. And so that was the first thing. So I didn't read too much because I didn't want to look at numbers. I felt that numbers can really change the way you see things, and I didn't want that for me. And then the other thing that happened is that I also decided that I was going to trust both my guts, but also my guts as a physician. What do I mean by that? And so I want to give you an example that's very concrete. So I got chemo, and everything, basically almost everything, went away with the chemo. And then we had to decide, are we doing a mastectomy or are we doing just a lumpectomy? And do we actually even need to do anything, since I'm going to be on treatment for the foreseeable future? Since when you have stage 4 HER2 positive, you want to have a treatment that's ongoing. And it took me a long time to really decide what I wanted. And the main reason was that my oncologist was incredible, and I'm so appreciative of who I had. I had to change because of insurance, and that's another discussion we could have. But she basically gave me the choice. She was like, would you feel really bad in case we don't find anything and we've removed your breast for no reason? And I thought about it, and I was like, well, that's true. I mean, if there's I don't want anything to be there anymore. That's my goal. And I don't know that I would feel so bad to remove it. And so I had to think about this, and it was hard to make the decision as a physician versus as a patient. As a patient, I wanted to trust my body, and I wanted to trust that my body was able to heal itself, right? But as a physician, I wanted to make the decision that made the most sense for me in the future. And I ultimately took some time, and I remember doing some hiking on the way, Camino de Santiago or Chemin de Compostelle. It's the same thing. It's a pilgrimage, and it's really remarkable path that I highly recommend. I didn't do the whole thing. I think I did like a couple of days, but it was wonderful. And I really thought about it, and I was like, well, what do I really want? What does my body want? And I decided to go with the physician, meaning that I didn't decide what I was doing based on my own intuition, because I decided at that point I realized that I couldn't really make that decision. And so I went back to, do I trust myself as a rheumatologist? And I think I'm a very good rheumatologist. I trust myself as a rheumatologist. So then I thought, well, if I do trust myself as a rheumatologist, I've got to trust this oncologist and the radiation therapist. I don't know if you say that, the radiation oncologist. Because the radiation oncologist basically told me it's easier to do the radiation therapy if you don't have a breast there. So the radiation therapy is pretty clear that it prevents recurrence in the same area. So that was not a question that I would or would not do in that area. But I decided to trust it, and I just went with it. And there was actually a little bit of cancer in there that was left. Whether it was active or not, I will never know. This would be another discussion, but I'm very happy I did it because I don't have any regret of losing that breast. I think, it's not losing, I don't know, of giving away that breast. I actually had a huge party to say bye to this breast. I was totally drunk that day. I think that was the first time I retouched alcohol after all the chemo and all this, but because it has sugar, so I try to avoid sugar. But yeah, so I decided that. And I think the next time and the next decision I had to make that was related versus, me as a physician versus me as a patient was the radiation therapy. So the radiation oncologist basically offered me the option. So the breast, there was no question. It's 2/3, there are good numbers, right? 2/3 chance of preventing a recurrence. That's almost a no-brainer, right? 66% chance that this is not going to come back thanks to the radiation therapy. Actually, it's not even like this. It's like there's 66 more chance that it will not come back versus if you don't have radiation therapy. And so at least those were the numbers for me. And so I was like, well, that's a no-brainer. I'm going to do radiation therapy there. No question, okay? But there was a question about the radiation therapy on the where there used to be a bone metastasis and where there used to be liver metastasis. And where I will say that my intuition really served me is that I kind of sensed that the radiation oncologist wasn't certain about those two. And that it wasn't as easy as, for the breast. And as I heard about, the potential complication from both the radiation for there, I just felt, well, I'm going to give it a little bit of more time. And then the next time I met with the radiation oncologist, she basically said, I don't know that it's going to help you. And the truth is that you're on treatment. We don't have anything else to radiate. And so maybe what we want to do is just follow and see if you need it, right? You may say, well, hearing this, I was like, ooh, does that mean that it's going to come back? But I think what it did for me is that I was like, you know what, I'm gonna trust my guts in this, and my guts doesn't tell me that I need it right now, right there. And I have time. I'm in remission. There is no more evidence of cancer in me. So I'm going to go with there is time. And, basically I'm praying in every single scan that there is no recurrence of anything anywhere in my body. But I'm really praying that there is never any recurrence. And my physician brain goes to, well, Plan B will be that we'll do radiation therapy, or Plan C will be that we will do some other treatment, and so on, right? So the way that we as physicians think, you have to understand how we think, and that's really important. So, right, I shared my thought process, and I want to share my thought process now as a physician, and I really hope it can help you make that decision when the time comes, right? We do not know for sure everything. We can only go with studies. Studies means that it's not you. It's not you as an individual, right? And so if you feel very strongly for or against something, your physician needs to listen to that, and that's extremely important. But there's science, and the science really comes from the studies of numbers. It's not just one individual, it's the numbers. And when we look at studies, we are looking at a number of patients, and we're trying to make them similar so we can get a better sense if the treatment works or not. And we can then say, well, the treatment works in this type of patient. And we do get numbers, and we do get studies that are showing us improvement versus no improvement. And then it becomes basically we decide what makes, sense. And I'm putting my hands here because it's like a balance. All right, in one hand, I have this condition causing this potential harm or that other potential harm, right? So in the case of cancer, so for example, my breast HER2 positive cancer is highly, it grows very fast. So the risk of death if you do not take treatment is very high. All right, so that's important because you take that into consideration. In the other hand, you take the medication. So in my case, the medication was a chemo and then the biologic treatment, very, very targeted treatment against the HER2. And the side effect of those treatments are much, much less. There's much less risk of dying from the treatment than there is of dying of the cancer. And so the balance goes in favor of let's get treated, okay? And it's the same thing for every single thing, right? So if when my patients come and they have severe inflammatory arthritis and that they've already, tried a medication that didn't have much side effect or like potential side effect and it's not working, the benefit of getting treatment is outweighs the benefit of doing nothing, right? And I know that the studies are clear that if I leave this patient with their pain, first of all, they're going to have pain. They probably will take narcotics, which don't really work in rheumatology, and that it's going to continue to destroy their joint. It's going to cause inflammation, so fatigue, and it's going to cause inflammation potentially to other organs, including the lungs and the heart and so on. And so you're deciding, you're like, well, that's not worth, I don't want to just leave it like that and say, well, we're not going to use this incredible treatment that really works. And yes, as potential treatment. And so as a patient, what you've got to do is understand where the physician is coming from. And you've got to make sure that they address your concerns. But you also got to make sure that, what would you do? What would you do if it was your mom? What would you do if it was your daughter? What would you do? And they usually, at least, I feel like the doctors that I would want to see and the type of doctor that I hope I am, I am very sincere in my answer, which is like, if this were me, I would do this, right? If this were me, this is what I would take, this, and so on. In terms of treatment, I think it's worth it because you can always stop a treatment. There's no question, it doesn't mean that you have to take a treatment forever. I think where it becomes a little bit more difficult is a treatment that's sort of, once you take it, you cannot go back. So for example, removing a breast, you cannot go back and put back my own breast. What you can do is, do a reconstruction surgery and so on, but you cannot put back my own breast. So when you do a surgery, you cannot, remove, go back, that's a decision. But I would say for me, one of the things that really helps me make the decision is to think, would I regret not taking that decision? And it's nice to be able to say, well, in this case, the physician is the expert in what he's telling me. And does this treatment make sense to me? Is he able to explain it to me? Is he able to reassure me also, right? Like, what does surgery mean? Is it really an easy surgery? Is it a very complicated surgery? Do I feel, that this surgery will work for me? And I will tell you, for example, because I have BRCA, I had a high risk of developing also ovarian cancer. And I didn't want to remove my ovaries because I did not want to become menopaused. And because of the breast cancer history, I cannot be on hormones. So really, like the moment they would remove my ovaries, I would become menopaused. And it took me, I think, a full year to make the decision of removing the ovaries. And it was hard. It was a very hard decision. I did not want to have any more surgeries in my body. I did not want, like, I was exhausted. But ultimately, I took the decision, and the decision I took because I read about the story of a PhD that had ovarian cancer in her mid 40s, and she didn't get the chance like me to prevent it, and so she died very soon after. And I kept thinking of this. I kept thinking, like, I don't want to feel regret. If anything happens to me, I don't want to have regret, right? So anything can happen to me, right? Like I can literally walk down the street and drunk driver comes and hit me. That's possible. But I have done everything in my power. I've looked at the light. I've turned, look left, look right, and then cross. I've done everything in my power to prevent that. And that's the same thing. I've done everything in my power when it comes to my health to prevent a cancer. And I think it would be, like, as a physician, I can tell you, I believe in the science of 2022. And the fact is that the science of 2022 acknowledge the power of our own healing, acknowledge the power of energy healing, acknowledges the power of Qigong, acknowledges the power of energy healing, of meditation, of exercise, of the power of love, the power of prayers. So we do acknowledge that, and there are studies to support that. But there are very, very good studies to support surgery in certain cases, as well as certain medication in some other cases. And because of that, I think that we've got to take it. We've got to take, we've got to use what we have at our disposition, right? Like, I don't, like if it's available, that's available to us. Is surgery available to you? Is treatment available to you? Is preventive treatment available to you? Use it. There's no reason to say no to this. And if the fear is what's happening, talk to someone that has already done it. And the truth is that I talked to someone that underwent breast cancer that had stage 4 also, and I asked her, and my oncologist was wonderful. She was like, do you want to talk to someone that has had that? And I had already talked to someone, but she had not had stage 4, and I think I needed to have someone that had the same stage than me, that was still on treatment like I would be for 10 years. And so I wanted to know that she didn't regret it and that she was happy. And she was like, no, I absolutely do not regret it. I'm so happy. She removed both of her breasts. And I was like, no, I'm only removing one. And maybe one day I'll remove the other one. I don't know. But I feel like in general, we can, do good testing for breast. But in general, just stop and just wonder, query, be very... not judgmental, be curious. What is it that's scaring you in this case? And I will say, from my perspective, I feel very secure. It was really something good to be a physician because it made life easier. I could, decide what was good and what didn't work, what was clear, what was less clear. But you can ask those questions to your physician and it will help. All right, so this is a little long and I'm sorry. I hope this is a helpful discussion. Please comment, ask me what you would like me to discuss. And I hope to see you next week. Subscribe and then share this with other people you think would benefit from this discussion. And again, it's a pleasure and I will see you next week. Take good care.